Now, I can only assume that the listeners and the viewers out there, they're hearing all this, they're digesting all this information, but the question, the elephant in the room that they probably want to know, how much will Medicare cost me? So let's answer that.
Well, that is the elephant in the room, and boy, that's a tough one to answer. You have to look at all of the different variables that come into play with Medicare. And like I mentioned at the close of our last segment, we want to make sure that you pick a plan that's going to be best for you, that doesn't bankrupt your retirement plans. Working very closely with Nolan Baker and his team here, we put a comprehensive plan together to make sure that moving into and through retirement is going to work for you and continue to do the things that you want to do in retirement. And one of those key elements is how much is the cost of Medicare and what's it going to do to my monthly budget when I am planning for retirement and Medicare. Dan, why don't you go ahead? We'll kind of go through this together, and why don't you go ahead and talk a little bit about how much will Medicare actually cost each individual?
Thanks, Scott. So, yeah, that's a question that we get frequently. Whenever we talk to one of our clients, they always want to know what's my upfront cost. So, Medicare, as we've been talking about, is actually alphabet soup. So, Medicare Part A, typically for those that have worked 40 credit quarters, your Medicare Part A will be free. For those that have not worked 40 credit quarters, there could be a monthly premium that you would have to pay for your Medicare Part A. So with Medicare Part A, there is a deductible. It's $1,636. So that deductible, that is on your Part A, that's your hospital stay. So anytime you go to the hospital, that's called a per benefit deductible. The coinsurance after a 60-day stay. If you're in the hospital for more than 60 days, there is a copay for that too. It's $418 per day. So as you can see, Medicare is not free. The premium for Part A for most people is free, but then switching to Medicare Part B, that's where you're going to incur a monthly premium. For most people, that monthly premium is $185. And if you're drawing Social Security, that will come right out of your Social Security check before you even see it. Scott joked a little while ago that some people may not notice it. I would notice $185 coming out of my check. So that's something that always make sure that you pay attention to. But if you're not drawing Social Security, they will send you a bill. They're very good at that. They will send you a bill on a quarterly basis. So you'll get that bill. Depending on your income, if you're a higher earner, you actually could pay more for Medicare Part B, more than $185. So that's something that we do discuss with you as well. When we go over a comprehensive retirement plan and comprehensive Medicare benefits for you, we always look at what your income is so we can give you an accurate picture of how much your Medicare in totality will actually cost you. Medicare Part B, that's your doctor visits, your blood draws, your physical therapy, that kind of stuff. That does have a deductible with it as well. That is $257. After that deductible is met, Medicare Part B does have a 20% coinsurance for most of the outpatient services after the deductible. I'm going to slip down to Medicare Part D. That is the drug coverage. We talked about that in a previous segment. You do have to have Medicare Part D, a drug plan, as told by Medicare. If you do not have Medicare Part D, you will have a monthly penalty for every month that you go without that. The Part D is going to have, it could have a monthly premium depending on the plan that you choose, depending on the formulary for that plan, whichever one works for you. So it will also have a potential deductible of $590 per year. That deductible will most likely, on the carriers that we talk about, only come into play on tiers 3, 4, and 5. Leaving your tiers 1 and 2, which are basically your maintenance medications on most plans, to be very low or no cost to make sure that you continue that drug regimen that the doctor has prescribed for you. The Part D plans that we talk about, they do have tiers, tier 1, 2, 3, 4, 5, depending on the carrier. And those will have co-pays in those tiers. Like I said a minute ago, some tiers are zero and some tiers could be a percentage. There could be what's called an IRMAA. It's a high income penalty charge for your Part D, meaning that you could have a higher premium based on your income.
Yeah, that's a great point, Dan. I brought a chart up here just to give you some ideas. With the cost for Medicare Part B, when Dan refers to IRMAA, it is an income test. And what they do is they look back 2 years. So for 2025, they're looking at your 2023 income, your reportable income for 2023. Just to give you kind of a really quick scratch the surface on this, the standard joint husband and wife filing taxes jointly, you can earn up to $212,000 and you'll have a $185 a month premium. If it is 1 penny over, it goes to the next bracket, which is 212,000 1 penny up to 266,000. That 185 premium jumps up to $259. All the way to the highest is 750,000 and above. Your monthly Part B premium is $628.90, and there is also a Part D income test that also increases. It goes from $1,370 up to $8,580. So one of the things that we're very good at, working very closely with Nolan and his team, is we want to make sure that you pay the least amount as possible for taxes and for your insurance. We can help you navigate maybe not taking some distributions out of reportable income to make sure that your premium for Part B isn't going to be higher than you expected, the 185. But Dan, that's a great point. You know, if you're not paying attention to what you're actually doing and what you're taking as far as income goes, it can definitely impact your Medicare Part B premium.
And thanks for that. But the chart that you're looking at, those numbers, people would think that they would stay the same every year, right?
Yeah, they would think so, but they change every year. I know 3 years ago that joint income was $196,000. It's up to $212,000 for 2025, and I'm sure that it'll change for next year as well.
Death taxes and Medicare, right?
Absolutely, absolutely.
Just finishing up here for you, going back one letter in the alphabet to Part C, that's the Medicare Advantage plan that we talked about. That's that all-in-one plan, your medical, your dental, your vision, your hospital, all of those benefits rounded into one plan, most likely for a $0 monthly premium. If you're going on the Medigap side or the standalone Medicare side, there are some other costs that you might want to consider. Do you want to buy a standalone dental plan? If you're going to need your annual dental work done, are you going to need a filling done? You can buy plans out there that we have contracts with that offer dental, vision, and hearing all in one plan as a standalone that we can help with you or help find a new plan for you. One thing we always want to discuss with our clients, Scott, if you can jump in here, the long-term care, that is not covered on original Medicare or a Medicare supplement.
Yeah, that is correct. That's something we're going to talk about in the next segment. But long-term care is not covered at all on Medicare, none whatsoever. So but we do have solutions for you on that. One thing that I want to kind of wrap up this segment with. Dan, you did a great job going through all of these plans and talking about the cost. Let's summarize a little bit. What I have seen, what I have noticed for the average person turning 65, going on to Medicare, I think this is going to be very powerful for them to hear and understand. The average cost, you're looking at roughly somewhere between $3,200 to $3,800 a year in premium. Now that is getting a dental, a vision, a hearing, prescriptions. Your Part B premium is not part of that. So if you're looking at all of that, you're looking at a cost of nearly $4,000 to $5,000 a year in premium alone. So, you know, on the onset, we were talking about how much will Medicare cost you. If you're looking for just original Medicare with a Medigap plan, you're looking at somewhere between $2,800 to $3,200. To get the bells and whistles and match the Advantage plan, you're looking at somewhere between, I would say, $3,300 to $4,000, and that's going to get you a pretty comprehensive plan. Remember, the Advantage plan eliminates a lot of that premium, so it's something to definitely take a look at.
Worth taking a look at. And once again, I want to reiterate here, the team at America's Medicare Associates, they're agnostic about the approach when it comes to what's going to work best for you. They want to find out what is, in fact, going to work best for you, whether it is the Medigap or the Advantage plans or some combination in between. But to find out more and to begin that process, reach out to the team. Go to arhq.com. Once again, arhq.com, or give a call. Set up a time, 419-794-3030.